IMROC stands for Implementing Recovery through Organisational Change, and it's really about looking at how staff are experts by their profession and service users are experts by their experience. And what IMROC really is about bringing both together.
We were up in Spelgadam with the service users from Downshire, and we were talking about recovery and hope and choice and what it means to them. And we were looking at the dry stone walls on the moorings and how they are self-supporting. They don't have any mortar to hold them together, and each piece supports itself. Although a separate entity or a separate skill, it builds together to make one solid stone wall that holds everything together.
We have 3 work streams that we've been focusing on in terms of IMROC. One is transforming the workforce, which is about appointing peer support workers, so people who have lived experience will now be working on our mental health inpatient wards.
Well, having had a mental illness and having found that very debilitating and having a sense of losing myself, I was asked to be involved in IMROC in promoting education and through recovery. And as part of my journey, I've been involved in training others and have recently been appointed as a peer support worker for one of the inpatient wards, which I'm really looking forward to.
The second work stream is around developing a recovery college where there will be co-produced training and education programmes which are designed by service users, carers and staff for service users, carers and staff.
We have a recovery clinic which is held once a week. We have carers evening, which is support for carers and patients on the ward. We have nurse-led activities which happen at the weekends, and from that patients develop a recovery wall. We also have pet therapy which happens once a week.
And also the personalisation and choice work stream, which is looking at developing up individual and personalised care for service users and increasing the number of people on self-directed support.
This isn't just about mental health, although we've had a sign up from all our mental health teams. We've had great commitment from the IT department, the communications department, from human resources and occupational health. We've even had a great commitment from the executive management team.
So every single team within mental health in the Trust now has a recovery plan, and our community and voluntary partners have also been developing trips as well. So the likes of Action Mental Health, Nave, Cause, Mindwise, Praxis, they've all been part of this. So at every level, whether it's at a policy level, at a training level, at an educational level, or even at a strategic level, we now have service users, carers and staff coming together to make decisions about how mental health services are delivered.